Hi, I'm Dr. Kaveh, and I care for patients in some of the most anxiety-provoking moments of their lives, like here in an operating room. And I take away the memories with the medications that I give so that they never remember the anxiety-provoking experience, but their bodies still take toll of what happened to them in that anxious and panicked state. And don't forget that your body opens up like a book when you're under anesthesia, and it can tell us all about your mental health and anxiety state, even if you're not talking to us. And that's why I want to share my top 3 hacks for helping reduce anxiety naturally before surgery. And it's true that I give lots of powerful anti-anxiety medications like midazolam or Versed, but I can't give those to you in a goodie bag to take home. So the more resilience my patients have before surgery is totally going to impact how their body responds to the anesthesia and how they're going to recover at home after the surgery. So number 1 is learning how to control your body, because a lot of my patients are afraid of getting embarrassed by saying things when they have a little bit of anesthesia on board. This does happen because anesthesia disinhibits your frontal cortex, meaning that you might say or do things that you ordinarily wouldn't do if you had your frontal cortex running on all cylinders. While I can't share with you what some of those silly things are, they definitely do happen, and patients get anxious over the possibility of those things happening because they fear losing control of their body. Fear of losing control can be a powerful trigger of anxiety and panic. And that's where the power of learning how to control your mind and body comes from. You have far more control over your body, even in vulnerable situations like in this operating room under anesthesia, than you've probably ever been told. Check out my video where I actually induce panic attack-like symptoms in my body with nothing but my breathing and my mindset. And I can also snap myself out of those same symptoms by controlling my breathing and mindset, and so can my patients. And there are also some supplements that I recommend, but I'll discuss that in number 2. But before we get there, let me share the powerful breathing techniques that I do with my patients before they fall asleep so that they can gain more control over their body and ultimately reduce their anxiety. My favorite breathing technique, especially before anesthesia, is what I call the 5 in, 5 out technique, where you breathe in for 5 seconds and breathe out for 5 seconds. So it's about 6 breaths per minute. And those breaths need to come from your belly, meaning your diaphragm is pushing down. And if you don't know what that means, it's super easy to figure out. Put your hand on your chest and breathe in and out. If you feel your chest moving up and down, it means your belly isn't breathing. You should try to breathe with your belly primarily moving in and out and not your chest. That helps activate your vagus nerve to minimize the flight or fright response from your sympathetic nervous system. And that can help reduce anxiety and panic states. That's what I did when I connected myself to this ventilator and monitor to take myself in and out of panic attack-like symptoms by controlling my mind and body alone without any medication. Moving on to number 2, certain supplements can help augment your mind-body power to better control your anxiety. Unfortunately, you can't use a lot of these before surgery because of how they can interact with the anesthesia or with the surgery itself. Some of these supplements can cause life-threatening bleeding when you're on the operating room table, so it's really important to not experiment before your surgery. That being said, aromatherapy with essential oils is typically considered safer than oral supplements. Always check with your surgeon and other doctors first. Many patients find peppermint and lavender to help with their anxiety, especially when used with the mindful breathing technique that we talked about in number 1. Unfortunately though, a lot of patients don't know how to use aromatherapy properly. It depends on your breathing, because if you don't inhale for long enough, you won't get enough aromatherapy absorbed through your lungs into your brain to ultimately cross your blood-brain barrier and reach your brain, where it can reduce your anxiety. One of the better studied techniques is to breathe in and out, like I shared earlier, 5 seconds in, 5 seconds out, 3 times, then to wait 3 minutes. If you're still anxious after 3 minutes, repeat the breathing again and wait for another 3 minutes. If you're still feeling anxious, you can repeat the aromatherapy breathing 1 more time. It can be effective, but you can't do it in the operating room before you fall asleep. But you can do it in the pre-op waiting area before you come into the operating room, and you can do it at home while you're recovering to also reduce your anxiety. And the better you can control your anxiety after surgery means the better chance you stand of having a successful and rapid recovery with fewer complications. And lastly, number 3. This is the most mysterious of all, but I think it's the coolest trick to crush your anxiety before surgery. And that's to lean into curiosity about what's happening to your body when the anesthesia starts to kick in. Curiosity is a powerful antidote to anxiety because instead of psyching yourself out over a situation that you don't have a lot of control over, you're taking a step back and being curious about what's going on in the situation in the first place. And what better situation to be curious about than what happens to your body as you're falling into the sleep of anesthesia. And the extra benefit that no one talks about is that the more engaged you are with your anesthesiologist as you're falling asleep, the better chance you stand of being able to fall asleep more relaxed and even to wake up more relaxed because of the insights that you might gain about your body and your mind and anxiety from the impacts of the anesthesia disinhibiting your brain. That does depend on the type of anesthesia used, on the type of surgery, and some other factors, but I always like to engage with my patients as they're falling asleep to help them wake up with less nausea, with less pain, and with less chance of developing PTSD should a complication occur. This is not woohooey, crunchy granola gaslighting. This is real medicine that I practice with my patients in real operating rooms like this one so that they have safer and more comfortable surgical experiences. The trick is to trust your anesthesiologist to guide you as you're falling asleep because the disinhibited brain is powerfully influenceable to unlock your inner healing potential. And this is one reason why I call my patients the night before surgery so that we can help their surgery and anesthesia go more safely and more comfortably. And to help build resilience against anxiety that'll help them even outside the operating room for the rest of their life. When used together, these techniques can be incredibly powerful to reduce your anxiety before stressful situations like surgery or other things in life. But don't feel pressured that you can or even should completely reduce your anxiety because a little bit of anxiety and stress can actually be very helpful in frightening and stressful situations. Like after surgery, a little bit of stress can actually help mobilize your immune system, and we don't believe that all stress is bad. But if it's blown out of proportion, like many of my patients that have severe anxiety that leads to panic attacks here in the operating room, that is unmanaged anxiety and it can be dangerous in the operating room and outside the operating room. I hope you can use these techniques to reduce your anxiety, and if you have a loved one who's having surgery, share what you've learned with them because you'll probably have more control over your health than you've ever been told.